I'm Sia, your anchor for today's episode of the Hair on Air podcast. We all know the importance of hair on our head because once our hair starts falling, it changes our looks completely. Hair fall has many reasons, such as genetics, age, and stress, etc. Today we have with us renowned dermatologist and trichologist, Dr. Shilpa R K from Bangalore. So, hi, Dr. Shilpa. It's so nice to see you here. How are you doing today?
I'm doing very well, Sia. First of all, thank you for the greatest compliment. Renowned dermatologist. As such, I'm not so renowned, just began my career. And thank you for the introduction.
Oh my goodness, that's very humble of you. I wanted to ask you, since you look absolutely gorgeous and your hair look absolutely stunning and amazing, I wanted to ask you, what's the secret of keeping your hair so glowy and shiny?
Thank you so much. First of all, when it comes to hair, so it's not like one particular thing. It's not like only or it depends on the diet or something. It is genetic also. First thing is genetic. My mom had very good hair. My granny had very good hair. So I think even my dad had very good hair. So basically, number one is genetic. Second is the diet. It is like a holistic thing, like good diet, sleep, physical exercise, nutritional therapy, and of course, I'm a dermatologist, so I know few secrets of hair.
That's very informative. So before we start the podcast, we'd also like to know more about you. Can you tell our viewers more about yourself and why did you choose to specialize in dermatology?
Well, there are two things over here. First thing is, in my home there are around 20 MD doctors. So there is no dermatologist. They are there like from different specialty, but there's no dermatologist, which is why I took up this branch. And secondly, after my undergraduation, I was posted in Dartmouth Medical College. I did my 1 year junior residentship over there. There I was posted in dermatology department. So I had to, I had a good exposure for the hair and skin related issues. In the dermatology department, you get to see a lot of cases. So that also, motivated me to take up dermatology. I discussed with my parents, even they said like for me it was suitable. So that's how I ended taking dermatology.
Oh goodness, that's quite a long story.
Yeah.
No wonder that you're so good at what you're doing. So let's start with the question now. My first question to you is, since hair fall is very natural, we all experience it. So when should we assume that we are having the problem of hair fall and we should take steps to prevent it?
To answer this question, in my OPD basis, I have seen a lot of patients asking that, Doctor, I'm losing 2 to 3 hair, 4 to 5 hair, is that the hair fall? So frankly speaking, losing up to 50 to 100 strands of hair fall per day is considered absolutely normal. One should not panic if there are, few strands of hair fall per day.
Alright, that's very informative. So my next question to you is hair fall only genetic? As you spoke about genetics earlier, is hair fall only genetic or do lifestyle and age and other factors play a major part in hair fall?
Yeah. See, genetic is one of the conditions. So to put it in like a practical point, if we discuss, there is male pattern baldness and female pattern baldness. So these two, variants of hair thinning can be genetic. But there are other aspects also, like nutritional therapy. If you're not consuming a lot of protein and trace elements like zinc, selenium, copper, these also can contribute to hair fall. It's not only the genetic. Genetic is one of the cause, but otherwise there are some nutritional deficiencies also contribute to the hair loss.
So, as you spoke about the lifestyle stuff earlier, so if we are using soap or shower gel or anything except for like a shampoo on our hair, can that also cause hair fall?
Yes, when it comes to product, definitely soap we don't recommend because soaps can make, because pH of the soap, it's not suitable for the hair. Always go for shampoos, and if you want to take something like still like a paraben free or sulfate free or fragrance free shampoos, that actually suits very well. And your dermatologist will always be there to guide you what type of shampoo should be used for what type of hair.
And Dr. Shilpa, as we spoke about shampoos just now, nowadays everyone is dyeing their hair different colors. Women are using hair colors, men are using hair dyes. So I just wanted to ask you, are there any special specific shampoos that if we use them, the color stays on for longer? And if we use those shampoos, does the texture of our hair matter, whether they are dry or oily? So we would like a descriptive answer for that for our viewers.
Okay, yeah, that's a good question actually. Nowadays, even in OPD, I encountered a lot of patients telling the doctor, "Can I dye my hair? Which hair is safe? First, which hair dye is safe? Which hair color is safe?" See, first of all, when it comes to hair or a hair color, these three composition, the PPD or ammonia or hair dyes will be there. So these are the things which alter the texture of the hair. Like they make your hair very frizzy, very dry because of these components in the hair dyes or the hair colors. So obviously there are some color protecting shampoos which can be used for the color treated hair or the dye treated hair. So definitely there are some pharmaceutical brands and medicated shampoos which can be used. And apart from that, you can also use a conditioner. Okay, regular use of conditioner is also recommended. And there are some hair masks also. So these hydrating hair masks also can be incorporated if at all you're using a lot of hair dyes in your
Alright, that's very informative. So nowadays one of the most common problems everyone faces is dandruff. So how does dandruff occur in our hair and does dandruff cause hair fall?
Yes. When it comes to dandruff, you should know that normally how our skin dries up during the winters, same way even scalp also dries up. So some amount of dryness, it is just called as dryness itself, dry scalp or dry flakiness we call. But when it comes to dandruff, you'll have excessive shedding. You say that we come across that patient saying that there is flaking all over the shirt and everywhere we see. Then for that we give a course of antifungal, oral medication, and we give antifungal shampoos also because fungal infection can be an inciting factor for the dandruff. Okay. Additionally, don't oil your hair. Keeping on, oiling your hair can also contribute to dandruff. So that has to be cut down. If at all you want to oil your hair, it is just an hour or two before you wash your hair. And again, there are some brands like ketoconazole-based shampoos or salicylic acid-based shampoos, which can be used for about 6 to 8 weeks or 12 weeks to take care of the dandruff.
Alright, Doctor, as you spoke about ketoconazole, I'd like to ask you about ketoconazole, ZPTO and moisturizing shampoos. Are they more beneficial for us and how do they exactly affect our hair?
Okay, so here that ketoconazole is available in two strengths, that is 1% and 2%. Ideally for dandruff, 1% doesn't work. So 2% is what we look into the shampoos when it comes to anti-dandruff. Because ketoconazole has got a very drying effect on the hair, so these other components like there are aloe vera paste, other moisturizing components are incorporated into ketoconazole, so that the dryness which is caused by ketoconazole will be taken care by other components. So that is why it's better to always use ketoconazole with other moisturizing components like aloe vera and all that. So that will be a good option to take care of the dryness caused by ketoconazole.
That's quite informative. So, doctor, to prevent hair fall and to make our hair healthier, what's the first line treatment that you would recommend to our viewers?
See, basically, when it comes to hair fall, it is not like first line. So, as I already mentioned, it is a holistic approach. So, first thing is we have to rule out for what you're having hair loss. Hair loss causes is multifactorial. It can be deficiencies, it can be genetic, can be trace evidence deficiency, or if you're having a lot of stress, or if there is any inflammation on the scalp. So basically we have to take care of the root cause for the hair loss. It's not one particular thing or the first line of the treatment. It is like a combination treatment which helps to take care of the hair loss.
That's quite informative. For my next question, hair thinning is very common. So how can we prevent hair thinning and how does it happen? Like what are the reasons for hair thinning?
Reasons for hair thinning, number one, 50% it can be genetic. It can be from anyone like maternal or paternal. But again, we consider that paternal is more significant. So first thing is we can consider some oral medications, topical applications. The treatment depends on the grading of alopecia. In case if you're in grade 1, we generally don't give anything like for long-term applications. We control it by oral medication for short-term, and then there are some serums, anti-hair loss serums, there are peptides, there are growth factors. And if it is like the baldness has gone to grade 2 or grade 3, then there are certain medications which you have to use for a longer duration of time. In fact, there are some medications which you have to use for life. And if there is something like very evident baldness on the vertex or the crown part, we also include injectables, and then there is hair transplantation. So depending on the grading of the hair thinning, we suggest the treatment accordingly.
Alright, Dr. Shilpa, as everyone is experiencing hair fall, is it different for males and females?
Yes. So to put it in, how to say, like there is androgenetic alopecia. It is of two types. There is male pattern and female pattern baldness. So how the baldness is there? For example, for men in male pattern baldness, it starts from the sides. So it progresses towards the end here. And then for females, it is from the when you take the partition, it should be as near as possible. If it is far, that means the baldness has just started for her. So in this also there is grading. So accordingly we start the treatment. So there is male pattern, there is female pattern baldness. Both are different.
Alright, so can lost hair be regrown?
Yes. There is the hair cycles are. There is anagen phase, there is catagen phase, there is telogen phase. So anagen is the growth phase, catagen is the resting phase, telogen is the shedding phase. So after the shedding phase, obviously there will be hair growth.
Do we have any hair nutrient treatment in order to get our hair back?
Yes. So there are some in-clinic procedures like mesotherapy, with the peptides, with the growth serums. So, and then we give serums also. So, to promote the hair growth and to combat the hair loss.
So, these hair nutrient therapies, are they different for males and females, or can they go through the same procedures?
See, almost the in-clinic procedures are the same as I've already mentioned, depending on the grading of alopecia. So, when the grading is advanced, we suggest some treatments like mesotherapy. There is platelet-rich plasma, PRP we call it. There is GFC, it's more advanced than PRP, which is giving very beautiful results. And if there is advanced balding, then there is transplantation.
Alright, Dr. Shilpa. So, when can we start considering, which stage of the hair fall can we start considering these treatments, PRP and GFC and other treatments? When do you suggest that we start considering them?
Yeah. So PRP is something like even we do for hair fall and hair thinning both. So it can actually be done as prophylaxis also. It's not like only you have hair thinning, that's why you have to do PRP. It is like your own growth factors we are going to inject into the scalp. So PRP can be done as a prophylaxis. And see, someone who has come with very few strands of the hair fall, or if there is no hair thinning, then that we don't suggest any injectables. So instead we give some peptide-based serums, and there is one more molecule called minoxidil, especially for male pattern baldness. We suggest this minoxidil, which they can use for a long term. They can try these preparations first: oral tablets, topical minoxidil, and with some hydrating shampoos, and then we can consider these injectables at.
Alright, so before we consider hair transplant, there are many other treatments that we can opt for. So can you tell me the stages of hair fall, and at what point do we suggest treatments such as minoxidil, Albert? So when do we start with those treatments?
So in grade 1 alopecia, we don't generally suggest minoxidil, especially for men. From grade 2 onwards, we suggest minoxidil. We combine the treatment. There are some oral biotin supplements, some trace elements, like zinc, copper, biotin, these I was talking about, number one. And number two, there are some peptides like there is redensil, there is capexil, there is procapil, which we combine with minoxidil. Like if we are giving serum in the morning, minoxidil will be given in the night. So these two preparations can be combined for hair loss and hair thinning.
So, Dr. Shilpa, many people, when they are opting for hair dyes, they want to go for the safer options. So, are there any hair dyes which are safe from harmful chemicals and which are very safe to put on our hair?
That's a good question, Sia. Actually speaking, no hair dye can be completed without these additives like ammonia, PPD. In order to call it as a hair dye, all these chemicals should be there. But there are patients who ask that we don't want these. So in that case, you can select a pharmaceutical brand or a medicated brand which will be given by your dermatologist. That you can. See, company says these medicated hair dyes do not contain these composition PPD and all. But frankly speaking, no hair dye can be completed without this. What you can do is you can ask them for a study or something where they tell these ingredients will be there, but the percentage will be very less in that. So those things can be picked. Okay, there are many formulations which will be given by a dermatologist than picking OTC brand where the composition of these will be more. So you can pick a pharmaceutical hair dye. Pharmaceutical brand which has less composition of these chemicals in that. And second thing is, as you asked, like many patients ask whether we can apply henna or indigo powder and all. These are, totally we consider them as organic. They do not have any dyes in them. But the side effect of these chemicals is they cause a lot of dry and frizziness. So probably you can consider them once in a while if you don't want to opt hair dyes.
Alright, that's very informative. Now it's time to debunk some commonly shared myths about hair care. So the myth number one is that wearing hats causes baldness.
Absolutely no. So this is again not only hats, they ask about helmets and all. So basically it's totally a myth. So it is not at all related to baldness or hair.
So Dr. Shilpa, we hear it a lot in TV ads that if we oil our hair regularly, if we oil a lot actually, even my mom suggests that I oil all the time. So does that cause our hair to be stronger and shinier?
See, basically, hair oils are not recommended and they are not required in your for daily application. But if I may name like certain oils like coconut oil, because it is proven it is a low molecular weight, so probably you can apply, leave it for about an hour or two. It acts like a conditioner. Okay, so it's not like recommend every day you have to use oil, every day you have to oil and take lip balm. Once in a week you can apply, wait for an hour or two, and then you can wash. Okay. It's not like strictly you should not or you should. So because it is proven, because of the low molecular weight, absorption will be better. So it can add on to your, it can combat dryness also sometimes. So coconut oil is one what I recommend, an hour or two beforehand, number one. Number two, now recently there are a lot of studies going on rosemary oil also. So we'll wait for the studies. But yeah, that also can be added, applied and then washed off. Don't keep it overnight or whole day. That should be avoided.
For the next myth, does frequent shampooing cause hair fall?
No, actually frequent shampooing, it's like you're exposing your hair every day for the shampoo. So ideally, it's not recommended to shampoo every day. Men can take, because men have a lot of oily scalp, there is a lot of sebum, there's sweating and all. So they can shampoo alternatively. For females, it is once in a week should be fine.
For the next myth, do only old people experience hair loss?
See, older people or geriatric age group, there will be hair loss. That is one of the reasons. Hair loss due to aging. But it's not like only them. Nowadays we see like even teenagers, even young kids also they come with hair loss. So it also depends on what lifestyle they're following, their diet, that also matters. This is also a myth. As we age, the geriatric hair loss will be there. Okay, it's not like only older people will experience hair loss. That's one I learned.
Alright. So for the next one, as you mentioned diet and exercise, so does diet and exercise play an important role in getting shinier and stronger hair? And if so, then what do you suggest for our viewers?
Okay, so definitely diet plays a major role. Again, if you have to talk about what diet, again protein. So excessive protein according to your body weight, not excessive, but according to your body weight, you can consume protein. Protein and hair health is directly deleted. So that is one thing. Secondly, good exercise, good sleep, even this also matters.
Alright, Dr. Shilpa, that was very, very informative. So at last, what's your message or suggestion for our viewers to get shiny, longer and thicker hair?
Shiny, longer, thicker hair depends on totally your lifestyle. And if there is a genetic baldness, don't worry. Your dermatologist is only a call away. Number two, eat good diet, balanced diet, I would say. Number two, good sleep, exercise, all this matters. So for hair, it is a holistic approach. We can't tell only this thing helps to the hair. It's like a holistic approach.
Alright, Dr. Shilpa, for conclusion, I want to ask you for the go-to hair care routine. Because we want to do something for our hair the entire day. Like right after we wake up, what do you suggest? Then once we are going out, is there anything that you suggest that we should do for our hair? And right before we go to sleep, what is the hair care that you suggest?
See, just like skincare, there will be hair care routine. So, especially for people who have very oily hair, I suggest them to wash their hair at least weekly 3 times. And for dry hair individuals, they can wash weekly once. And whenever you wash your hair, make sure you use a conditioner. Conditioner does play an important role as much as shampoo. And then there are good hair masks, which are oil-based for dry hair, which are meant for different hair types. And every day morning, you have to comb. I've come across few patients telling that, doctor, I don't comb. If I comb, I get hair loss. So please don't do that. So you have to comb every day. Combing and massaging and all that also increases the circulation. So that will add on to your hair health. So number one is combing. So everyone does it, so you have to comb. Number two, you can apply some leave-on serums, and that will keep your hair hydrated. And number three, don't keep on touching your hair. Even that, whenever you're touching, you experience a lot of hair loss. Number three. And night time, it's nothing like for long hair, I prefer tying them, like they can just braid it and sleep for females and then have short hair. So they can just leave it. And according to your concerns, like if there is a hair fall, you need a serum to keep it overnight. So this is a night routine. And then weekly once, there are some ruling and all that we teach in the clinic. So that is not something like we allow them to do it at home. After we teach them, they can do it weekly once. These are simple hair steps which you have to follow at home. That's all.
Alright, that's very informative. Thank you so much, Dr. Shilpa, for taking your part of your busy schedule to educate our viewers on how they can get long, shiny, thick hair. I'm sure that our viewers will follow your advices and suggestions and get better hair. Thank you so much, viewers, for staying connected with us on the hashtag Hair on Air podcast. We are available on Instagram, YouTube, Spotify, and Apple Podcast. That's all for today. See you in the next one with a new expert. Thank you.